One of the obvious sources of resistance to telehealth consults that specialists who are physical based is the obvious inability to lay on of hands, to actually touch the site of the injury and to make determinations based on what can be palpated. These concerns are absolutely valid, and the gold standard is certainly to conduct assessments via face-to-face where a physical examination is absolutely required. However, given the guidelines now around social isolation in the wake of COVID-19, many medical experts and patients are reticent to leave their homes. And this leaves the option of telemedicine to continue to assess individuals under the personal injury schemes. Therefore, what is an orthopod or an occupational physician or a neurologist to do? What are the expectations of you given that you cannot physically touch the individual? Most insurers and regulators are quite pragmatic given the current circumstances, and the advice is to do what you can do. It's better than having nothing. Determinations and support and help still needs to be provided to injured individuals, even if only 90% of the advice can actually be provided. So the recommendation is to do what you can do. There is still an awful lot that can be picked up from conversation with the injured individual. There is a lot that can be picked up by looking at redness and swelling, by looking at the way the person moves, how they walk, how they bend. And if you feel that you cannot confidently provide an answer to a question, then the expectation is simply that you say that you say that the assessment was limited by the inability to lay on of hands and to palpate the injury, and that another assessment would be required at a later time to answer that question confidently. The message here is that given the current circumstances, it is better to have the medical advice that you are able to provide that can help to progress the situation for injured individuals within the scheme, and anything that you cannot confidently comment on, to make note of that. Insurers and regulators also recommend that you use whatever tools you have available to you that can help you more confidently and effectively assess the individual. If you have any apps, if you have any remote tools, if you have any techniques that you can adopt from a virtual perspective that's going to help you increase the confidence of the opinion that you provide, you are free to use it without having prior approval from the regulator or the insurer. This may change when the effects of the coronavirus have settled down, but for now, the message is use whatever tools you have at your disposal to increase the confidence of the opinion that you're able to provide.